Here's what we're going to do today. We are going to talk about what is called internal family systems therapy. This is a model of therapy that therapists use to theorize and conceptualize about their clients, and is something that can really help drive various interventions. And it's just, I think, a really cool way of thinking about therapy. So there's kind of a debate about what type of model this is. Some people would say it's an experiential model, which is all about like emotions and stuff. Others would say that it's a psychodynamic model because it really deals with self. It's got like this real nice complexity to it. I mean, kind of the basis of it is that
agent is joining your team.
as couple and family therapists, we have this tendency to see individuals as being embedded in context. And what internal family systems did is Dick Schwartz is kind of he's the head honcho guy who created it. But what Dick Schwartz basically said is, you know what, we should take the way that we conceptualize the outer world systemically, and we should do that internally as well. That we all have an internal system that is part of what drives our behavior, our interactions, our desires, our needs, etc. So this is it's just a really cool, intuitive model that, if clients enjoy the language of it, can work really well. So some of the stuff I'm going to give you guys a heads up just so you know that what I'm going to talk about today, you may find yourself listening to and saying, this sounds really dumb. And if that's the case for you, that's okay. If you listen to it and you think to yourself, oh my God, like this sounds so cool, and sounds like something I would absolutely love to have a therapist use when they're working with me, then you're gonna love this. Okay, it's not like I'm not trying to paint it as if it's this big polarizing thing, but it really is a model that you have to conceptually enjoy and understand in order to be able to navigate well. So what I'm going to do is I'm going to give you guys a little bit of an overview in the same way that I would if I was going to explain to a client how this works, because I never go into therapy expecting that a client is going to understand the way that a model works. I went to school to learn how this works. I've read books and articles and all these fun things on how this works. So I would never expect that a client would understand it. Thus, I would never expect that anybody watching this lecture right now would ever understand it. So if you are lost at any point, tell me, because I have tried to adapt this lecture to be more accessible to non-therapists. Internal family systems therapy is, as I said, a model that is focused on ourself. And so I'm going to start by drawing a diagram to help you guys make sense of what I'm about to talk about. So as a systemic therapist, one of the things that I'm always thinking about, if we have, so let's say we have you. Okay? This is you. If you come to therapy, one of the things that I, as a therapist, am going to be thinking about, because I was trained to do this, and I believe very much in this, is I'm going to see you relative to your context. I'm going to see you as embedded within relationships. That you are part of a system. This has otherwise been drawn before as if we have you, the individual, you have what's called the microsystem, the mesosystem, the macrosystem, yada, yada, yada. It's a series of expanding systems that we are all embedded in at all times. That should intuitively make sense to you. So think about like your loved ones, your relationships, your friendships, whatever it may be. Those are your system. And one of the things that we theorize and we think about all the time is that you have an impact on the system. You influence that system by the way that you show up into it, by what you say to people, by how you respond to them, etc., etc. But what we also say is that the system has an impact on you. Now, I'm drawing these individual lines from person to person, but if we took this and said, these guys, we took this and said, these guys are a subsystem, we could also make the argument that we have a reciprocal influence on that subsystem in the space between these people. So if this is a couple, you relative to that system, this gets very, very, very complicated very fast, as I'm sure you can tell while I'm talking about this. And I'm not going to belabor this too much, but this is an important thing to understand about how a person like me thinks when I'm doing therapy. So even if it's just you in the room, I am constantly thinking about the relationships that you have outside of the room, how they've shaped you through time, how the present relationships shape you, how past relationships shape you. So in comes internal family systems, where we would say that in your giant head, normally we think that this is just one person, but that in your head, you are comprised of a core self, and that self is surrounded by what we call parts. I'll get into what this means in a second. That we have parts. Now this is in your head, okay? So this is all internalized. The idea is that this then has become an internal system in the way that I just described. That these parts exert influence on the self, and that the self exerts influence on the parts, and that the parts also interact with each other. And you have all these really cool, complex networks of internal systems that are going to shape the way in which you conceptualize the environment. Now, this is a very front of your brain idea. Okay, we humans have a prefrontal cortex that's capable of creating this. This is a very abstract conceptualization. It's not something that we would look at and say, oh, you know, this is so easy for any animal to come up with. This is a very difficult thing for us to come up with, okay? Now, another foundational principle of this is that every single one of these parts that's in our head has a role. So some have, and we'll talk about these roles in a second, but that these parts can take on various roles in the way that we behave. And so there are 3 different types of roles. Again, we'll talk about those in a minute, that you may see something that looks kind of like this in terms of like the roles that they take. All right, all parts will take some kind of role at some point or another, potentially. All right. There is no defined number of parts in a person's mind, so it's not like you have 5 parts and that's it. Some people have many parts. Some people have a few. Some people have parts that are particularly salient to them and others that they don't really pay much attention to. Some have parts that are loud. Some have one that is just dominates the rest. Okay, but these parts, when created in our head, they take on various roles relative to what's happening in our relationships and in the environment. Most people who study and talk about IFS would tell you that this happens somewhat organically, but it happens through learning. That we develop our parts relative to other relationships that we have been in at various points in our life. So so here's what I'm gonna have you do. So think about this for a second. Let's say I asked you the question, presented you with the question. I said, would you like to go to McDonald's with me this afternoon?
Accessing network. Establishing up.
Let's say that a person says to me in response, well, a part of me wants to go, but a part of me doesn't want to go. A part of me really wants to go to McDonald's and eat with you, Dr. Mick, but another part of me is scared of the coronavirus or is scared of the risk that goes along with that. This happens a lot. A lot of us use this type of language. I'm sure you've probably heard it before in your life. You might have even said it. Oh, yeah, you know, a part of me really likes Dr. Mick's stream. Another part of me gets really bored. A part of me wants to get married. A part of me doesn't. A part of me wants to do, right? And you usually talk about it as being this dichotomy. Okay, so like one part wants to do one thing and one part wants to do another thing. If that language sounds intuitive to you, then internal family systems is going to make a lot of sense because it is kind of founded upon that language. It takes that language and then operationalizes it in some way. So let's use that example. All right. So I say to you, you want to go to McDonald's with me? You are sitting here and you say, well, a part of me says no. Another part of me says yes. Okay. What I would be doing as a therapist is asking you more questions about this part. What is this part? What does it want for you? Tell me about the part of you that is saying you don't want to go. Tell me about the part of you that is afraid that if we go to McDonald's, we might get sick or we might be at risk of exposure to coronavirus or whatever it might be. Tell me about that part. And what a lot of people will do, if you poke and pry enough with some of the better questions that you can ask, will start to define this part and may even name it. They may say, this is a fearful part of me, and this part actually feels like it's like 6 years old. This is a part of me that tends to show up when there's something scary out there. It's a part that yells at me constantly that I'm at risk. And no, Mars, it's not. This is just for the sake of illustration. Okay? And then this yes part is the part of me that is really like just wants to enjoy life, that wants to do whatever I want, that believes I should be able to do whatever it is I want at any given time. And that part comes out for me a lot. And these parts tend to really go at each other. And oftentimes I notice that this part ends up driving the bus, which is a phrase I'm going to use here a lot in a second. Right now, I'm still at the surface here because I want to make sure that you guys are following this language, because when I go into this deeper conceptualization part, I really want to make sure that it makes sense. I'm going to give you guys one more example. This is an important way to think about this. The self, which we're going to talk about its traits in a second, think of it as being the conductor of an orchestra. So you have kind of these parts over here that are in this section. You have these parts over here that are in this section. You have the parts over here that are in this section. And all these roles have a part. All these roles have an instrument to play. Yourself is the conductor of that orchestra. All right, and I'm going to keep this diagram because that's going to be good for illustrative purpose. I want to be very clear also while we're talking about this that I'm not talking about like multiple personalities. I'm not talking about like schizophrenia. I'm talking about, for the most part, like people who do not have like a severe psychosis of some type. We're talking about kind of like neurotypical, not neurotypical, that implies that a person with autism can't get on board with this, but they absolutely can. Like a person who we wouldn't say has like debilitating psychological issues going on where they have like multiple personality disorder, stuff like that. Okay, so your dissociative identity or anything like that. We're talking about kind of like on its surface, day to day, who you are, how we conceptualize it. There are some assumptions that get made in internal family systems therapy that lay the foundation for everything that I'm going to talk about here that always have to be kept in mind if you're a therapist who's working with IFS, but is also very important for people to understand if IFS is the type of therapy that they are consuming. The first is that, as I've explained, people are made up of all of this, okay? All of this equals a person. So you have yourself, and then you have your parts. And that the wholeness of this internal system is what is going to create or comprise the person at hand. All of these parts have various roles that they take on and are in relationship to a healthy core self. Now, I'm going to get a little bit philosophical here. This can be debated depending on what you think about these things. I'm going to go just with what internal family systems therapists say about this, not what anybody else would say. The idea about the self is that the self is inherently good. The self is inherently compassionate, patient, curious, kind, and just expresses good vibes. It is this pure, I wouldn't call it like naive, but it's the pureness or the essence of the good in a person. And that is always true. No matter what person or people you were talking about, the core self is always good and compassionate and kind and patient and assertive and direct. It's like the part we accept. It is not so the self is not a part. I really love that question, Beckdorf. Very important to recognize and understand as it relates to this, that the self is not a part. The self is its own thing, which is why I kind of draw this divide here between the self and the parts. The self is the conductor. The self is the running narrative at the end of the day. The self is also, like a conductor, the one that consults with and pulls from what different parts have to say so that the orchestra sounds good and is pleasant and is navigating things the way that it should be. You might also, if you want to use a different analogy, it's the captain of the boat. You know, all the parts are various roles and deckhands and fishermen, but the self is the captain. It's the thing that pulls on and puppeteers the entire thing. The second assumption that I'll go into, the rest of which I'm going to kind of let fall by the wayside because I think they're a little bit more advanced and out of the scope of this, is that if we make changes to the internal system, so if the self, say, goes over here and says, hey, this part, come here, I need you to be louder. Be louder, come help me, consult with me. That if we make a change to this in the way that the self is going to interact with the parts of the system, that will change how we interact with the external system. In some ways and vice versa, but really we're going to be thinking more inside out. That if I make a change, if I do a lot of work on my internal world, then I can also change the way I show up for various relationships and influence the external world. I hope that makes sense. I think it's pretty intuitive. So when I'm working in therapy, I can do this in a systemic context. I'll get to that if I have time. But like for right now, if you're thinking about you as an individual, this is what I'm referring to here, is that I would be looking at you saying, we need to learn about, navigate, define, understand your internal system so that you can do a little bit of work here mentally. And then that's going to influence the way you show up outside of it. Hobbies or interests are generally not going to be considered parts, Mia, and I think that will make sense to you as we go through the lecture today. Those are interests. Those might be things, certain parts may be interested in those things, but ultimately the self is going to drive interest. So I'm going to draw a chart that you guys may be familiar with, that I have drawn multiple times before, because I really think it helps us conceptualize what it is that's happening. And just as a refresher here, these red arrows on the left are what we would consider to be what's called the problem sequence, or the problem. Think about this as being the chain of interactions that you would say like is a problem. So if you're thinking in your mind right now, what's a problem I have in my life, we would say that problem is embedded within a problem sequence. Over here, we have what is called a solution sequence, otherwise referred to as goals. These are constraints, which are the things that get in the way of us being able to implement that solution sequence. And our goal is to move from this direction to this direction, is to lift the barriers to be able to implement our solution sequences or to solve our problem. That's just a refresher on this because that's going to drive the way that we conceptualize this next part. So again, I'm going to define parts more readily here when I get into examples, but I will first want to make sure that you guys understand the core conceptualization of this. Otherwise, believe me, I'll lose you, and I don't want to lose you. All right, so the very first thing that we have to think about as it relates to this is how do we achieve our goals? What do we consider to be what we would call healthy development? Like what is healthy from a internal family systems perspective? What is it that we're striving for as this theory would define it? The thing that we're going to be striving for with this is we want to be what's called self-directed, meaning that at the end of the day, the thing that we're going to be wanting is for our self to be the thing that is leading the way we show up into the world. We want the self to be directing the orchestra, to be directing the parts. This includes consultation with parts. All right, that's just part of being self-directed. This also means reassigning roles for parts, which is an important piece that we'll get to here in a second. All right, but it means that we have kind of this, we have harmony. That our self and our parts are working together to allow us to be the best we can be. And that is what we're striving for. I'll talk about how we get there in a minute. So conversely, what we have over here on the problem side is what we would call like, problem development or pathology. And so how does that develop? Well, the way that this develops, you may intuit this a little bit from how I'm talking about healthy development. The way that this develops is when one or more parts. So if we have one part or a group of parts that take hold and override the self and make it so that we are no longer self-directed, we're going to have problems. That any problem you bring to me and you described, whether it's in a relationship, whether it's in your family, whether it's in, individually, whatever it may be, whether it's at work, that if you're having problems at the level of interaction, that's happening because your part or some group of parts is driving it. That rather than being self-directed, listening to the compassionate, the patient, the core good, parts have gotten off the rails. All right. So part directedness is going to lead to issues. We even would consider this to be like domination, poor internal boundaries, also, this is going to be driven by lack of understanding of the internal world. That oftentimes we might also have problems because we just don't understand how this works. Again, this is from a pure IFS standpoint. All right, that we don't have an understanding of what our parts are. We don't know who they are. We haven't defined them. We don't know even which parts are coming out. Right? So a problem may occur because a part's leading, but you don't even realize the part's leading because you don't know that the part exists or you haven't defined it as such. It's Sam. That's a really good question, right? Would it be something like anxiety would be controlling your decisions? What we would say is that there is an anxious part of you. And that part, in response to the anxiety, is pushing various behaviors that are destructive to you. So we might say something like, so if you have an anxious part that's really loud, really big, and that anxious part is screaming at you at all times to get reassurance from your partner that they love you, so you engage in excessive reassurance seeking with your partner, IFS therapists would look at you and say, that part, which we'll define as what role it has in a second, that part is driving your behavior instead of you being self-directed, really checking in and asking yourself, is this something I actually want to do, or is this me acting on an impulse because there's anxiety? We would say that there's a part driving it if it's causing issues. This is very, I get the question a lot. How do you know if you're being self-directed or if you're being part-directed? It's a very difficult thing to determine, which is why we have to look at a pattern of responses, and we have to really define these things and try to understand them better so we can be a little bit more understanding of what's happening. And yes, M. Beckdorf, I would consider that to be like domination. Would this include examples of trying to break behavior patterns similar to military reintegration into a civilian? Yes, Yora, you could make an argument that when a person goes through the military, they have to either create or reshuffle certain parts into different roles and may have to be incredibly part-directed. And that when they come back to civilian life, those parts that have long protected them while they were out in the service is no longer protecting them in a way that is useful to them and may actually cause distress and start dominating. Yes. You could apply this to just about any presenting problem or issue that you... These are the ways that pathology occur from an internal family systems perspective. So the goal of the model is to help a person move from that problem development, that pathology, to healthy development. Help that person become more self-directed, reassign those roles, get better acquainted with what's going on. That's our goal. That if we can do that, we open ourselves up. When we're self-directed, when we're consulting our parts, it opens us up to solve our problems and engage in the ways that we want to. Where you feel as if you are walking through the world in a way that you want to engage. Where you are feeling this deep, and I mean deep, sense of like control, that you're at the reins. That you're no longer slave to various like impulses, that rather you can recognize those impulses and be self-directed in the way that you manage them and understand what those parts are wanting for you. There is a very Zen vibe to this model, and there's also a lot of mindfulness that is involved in it, I think, which should make sense, right? Like we're really having to pay attention to what's in our inner world, and mindfulness is one of the ways that we do that. I don't mean meditation, by the way, I mean mindfulness, but that we're going to really have to engage with this system so that we can look at it and we can recognize, here's a part's talking to me, there's a couple parts talking to me, there's some parts hovering. Self-disclosure, there are a couple parts that are hanging out with me right now, one of which is saying, you better do a good job and explain this well. It's a part that wants to be accepted. It wants people to see me as informative and useful and, welcome. And so that part is sitting here and I've had to talk to that part about, I'm going to talk about IFS today, and I know you're here and I know you want me to do well, but I'm going to do my best. Thank you for keeping me on my toes. Thank you for helping me recognize that I care very deeply about this. It's just a part that cares and wants connection. And that part's deciding that is through achievement, and that is through explaining things well. And so I know that part's here, and I have to consult with it so that I can be self-directed in this rather than allowing that part to go crazy and take over and then start dominating the lecture, because it would be destructive to the entire process. That part might be vigilant for times when people are saying things that appear that they're confused about what I'm saying. And if I let that part drive, they're going to say, see, you're an idiot. You're not teaching this well. You're not doing a good job. It becomes very critical. So we have to keep that part at bay. Not gone, at bay. We'll talk about that in a minute. Okay, so Alaya, I love that question. I hope I said your name right. Parts can be very, very good at convincing you that they are yourself. There are some parts that become so ingrained and so listened to that they basically will act as if they are the self. But when you're in therapy and you start to really dissect it and you start to notice some of these patterns and you define that as being more of a part that has done a really good job deceiving yourself because it doesn't trust you, then we can become a little bit more self-directed and set some better boundaries with that part and repurpose that part. Correct, Cheesy Puff. You might say something like, I know that what's healthy for me is to grab a handful of cashews for a snack right now. There's a part of me that desperately wants to eat cake. And then we would want to get to know that part, and we would ask that part, like, that's like the childlike part of me that wants to indulge in everything, or that's the part of me that believes that I should just be able to do what I want and eat what I want. That is an impulsive part of me. And that part's yelling real loud. What does that part want from me? That part doesn't necessarily want me to eat cake. That part wants me to enjoy myself, and it's focusing on cake so that it gets me to eat it. But I know that that's not good for me right now. So I'm going to consult with that part and say, thanks for telling me that I still love cake, but I'm not going to eat that cake right now. I'm going to set a good boundary with you. Thanks for coming. Thanks for hanging out. Thanks for giving me the option. Not interested right now, part. It becomes this internal dialogue, right? And then that drives your external behavior. You have just reorganized your internal world, right? You've just reorganized this internal world, and now it has affected the external world because you have made a choice that is better for you. It is not strictly about impulses, Toaster, not at all. This is about, sometimes people experience parts as impulsive, but it would be like an impulsive part. What this really is about the conversation that we have internally. It's the do I not want to? What do I think over here? Right? It's kind of like part of the decision making, but it's this idea that there are these parts that are, I mean, sometimes people will conceptualize them as being people. Sometimes they'll conceptualize them as being like a smaller version of themselves. Like 6-year-old me really wants to go do this, but adult me knows, this big adult part that thinks I have to be careful and, fiscally conservative is saying no. And, at the end of the day, what do I want to do? It's not all about impulses. We tend to experience parts as impulsive if we aren't paying attention to them. But for the most part, what we're talking about here is just that internal world. Sometimes impulsive, sometimes not. It's a great question. And M. Beckdorf, Avatar is actually a really cool example of internalized objects and internal representation that actually I think works even a little bit better with object relations, which we'll talk about another time. But you can apply IFS to this. One of the most common pieces of media that is compared to IFS, or that IFS is kind of associated with, is the movie Inside Out. That the person is comprised of those parts that are inside, that are at the controls. That it's missing kind of the self component of it. It kind of makes the idea that one part is better than the others. But Inside Out is a really cool way to conceptualize parts. If you're having a hard time really letting it, figuring out how to let this sink in, if you think about Inside Out, that's kind of what we're talking about in some ways. So if you're so used to having a really loud part for a certain reaction and you don't know how it would be without that part stepping up, yes, that happens all the time, Snazzy, which is one of the ways that parts and being part directed can be so seductive, because that part will tell you, you need me. I have helped you survive. I have helped you so many times avoid risk. You need me. Don't you dare set boundaries with me. Let me drive. Ultimately, that part is just trying to protect you. It's just trying to make sure that you're safe. But that part might be creating destructive behavioral patterns because it's not self-directed so much as it is being driven by whatever the emotional experience of that part is at a given point in time. We often align parts with emotions. It's kind of a common way to do it. Not always. I have had people that name their parts. I've had people that say, oh man, there's this part of me, and I call him I'm totally making this up. But if I was so I'm Ryan, but man, I have this John part. And John is very untrusting of the world. I do not, but in real, if I had a lot of trauma experience, or if I experienced a lot of trauma, John is the part that is always vigilant about my trauma. John takes care of me. John's always watching. John is hypervigilant. Sometimes it helps people to name their parts. You don't have to do that. And Cheesy, you do that through a lot of conversation. Oh, John, what's up, buddy? It happens through a lot of conversation and really trying to get to know him, trying to be as self-directed as possible. One of the things that happens in therapy is if I notice somebody starts talking in a way that feels sort of off or like critical. Remember, because we again, kind, compassionate, clear, pure. If a person starts engaging in a lot of self-directed criticism, that's a part. Like, tell me about the part of you that's saying that to me right now. Right? They say, oh, a part of me really wants to engage in therapy, Ryan, but it's scared. Tell me about that part.
Alert.
All right, so now that this is covered, we're going to talk about what a therapist does. Oh, no, sorry. There's one other thing I have to talk to you guys about. So we're going to go back up to this chart real quick. So in this chart, what I've drawn are 3 sections. And well, actually, no. I'm going to do it this way. We have our parts. And those parts take on one of 3 different roles. If you want to keep the orchestra example, you might say they play one of 3 instruments, although that doesn't quite work, which will make sense in a second. There are 3 different roles that a part can choose to take at any given point in time, and usually what happens is parts will kind of keep these roles as much as they can rather than changing them. The first type of part that we are going to talk about are what are called exiles, or exiled parts. I'm actually going to draw that over here. All right, exiles. Now remember, these are roles. These are roles. Exiles. Exiles are parts that it's a very tough role. Exiles are the parts that are often in pain. Exiled parts can be like and sometimes, I mean, it has been said before that they are in a state of pain and trauma. All right. That these parts are often scared, afraid, alone. All right. These are parts that are intensely vulnerable. Let's say there is a part of you when you were growing up that wanted approval. All right, that really wanted to be acknowledged and seen and loved. And so that part of you, like that part, you would try to engage with your parent. Like you might say to your parent, like, look at this drawing I made. Watch me do this. Watch me do this. And by no fault of your own, your parent just neglected that. Shut it down. Maybe even abused you. You went to show the picture, your parents said, that sucks, and they hit you. And that became a patterned theme. What we do, without really thinking about it, is we then exile that part. We basically say, if we have like our rows of parts, and let's say that's this part right here. I'm going to highlight it here really quick with some rainbow. Okay. So this part right here is that part that longed for connection. What will happen is that part will get sent away. Will get sent to the back. Or will be exiled from the orchestra. Will be sent out. Because it's too painful. What this will lead to, oftentimes, if we use this part as an example, is that those things you did to facilitate connection, to show that you're prideful, to show that like you are so happy with what you've accomplished, you won't let that part drive anymore. You won't do those things. All right, and there's a way in which that happens, which is where we're going to talk about the next type of part here. The next parts that we have are the ones that you're going to most commonly interact with as a human. These are called managers. If you want to call them the Karens, you can do it. All right, but we call them managers. Managers are responsible for a few things. First, what they do, they protect exiles. Oftentimes, these parts regulate our behaviors. These parts, more often than not, contribute to our internal running dialogue. Basically, think about that as being your internal voice, the voice you hear in your head when you're sitting there thinking. I guess that's true. Karens speak to managers. That's a good point. Good point. They also, attempt to do this. They don't do it very well. They also sometimes try to protect the self, but they're misguided in the ways that they do that. All right, but they maintain, finally, they maintain daily functioning. All right. So these are the parts that are on the front lines. These are often the ones that you're going to consult with first, that you're going to hear from first. They're usually pretty firmly defined. Exiles, sometimes people have a hard time defining, right? But you got these managers. Now, again, what you have to remember is your parts take the role of manager. So when I made that distinction about the part of me that wants to be connected and loved and taken care of, that part could also take a manager role if it turned out that way. In the example I gave you, that part got exiled because it was vulnerable. In some ways, there's always the question, who exiles it? Exiles often are they're self-exiled. The self doesn't, throw parts away. It's not the one doing the exiling. It's more that that part says, nope, I'm out. Peace. Hell no. Okay. But it's in this very vulnerable way. People will often experience, by the way, exiles as being very childlike, very, very basic in their understanding, very emotional in their way of showing up to the world. They're very young. Managers often are more like teenagers and adults, if you want to think about development, human development. Okay? We have what are called, I always love this, firefighters. Firefighters, when managers fail. All right, when shit goes up in flames, here come the firefighters. I'll give you an example of this in a minute, okay? But they are like protectors, but they are way more like brash. Like they're not nuanced. They're brute force. Brute force protectors. All right. They're the last line of defense. They often will redirect our attention. And they serve as protectors of both managers and exiles. They can show up if an exile is pulled out without it wanting to be. If an exiled part comes out, that is an exiled part coming out is terrifying for people. When exiles come out, it's incredibly vulnerable. It's scary. Managers will usually do what they can to try to stuff the exile back and get it back into exile. And if they can't do it, then firefighters come flying out to try to figure out how to do it. All right. In some ways, they are fight or flight. Yes. So I'm going to give you guys an example. All right. This is purely hypothetical. All right. I am not pulling this from anybody I know. Okay. This is purely hypothetical. So you might have an instance as a therapist where a person has, let's say, trauma in their life. and they were abused, and there is this childlike part that was exiled that is somewhat of like a free spirit and is creative and really wants that connection with others. All right. That part was exiled. In therapy, that exile is always listening to what the therapist is doing, is always paying attention. They sit in the back and they listen and they watch. If a therapist goes directly for an exiled part or sees that an exiled part is creeping out and beginning to talk, and the therapist goes ham on it and is like, ooh, I got an exile. Come here. And then all of a sudden that person's managers just fail. Like maybe that person has a manager where they start making jokes and the therapist goes, nope, not attending to your jokes. Keep talking about the abuse. Nope, I'm not going to go with your redirection. I'm not going to answer your question. I want you to answer my question. And keeps busting manager parts away. A firefighter will come in, and in some instances, a firefighter could be where a person all of a sudden gets a migraine. Just out of nowhere, massive migraine, huge, might have a panic attack. Panic attacks often are induced by firefighters because it gets person to back off or redirects, right? Because again, we're talking about redirecting our attention. A firefighter could be when a person goes to grab a hit from a joint. A firefighter might say, get absolutely wasted tonight. Stop thinking about this. A person may also dissociate. Firefighters can actually push a person to dissociation where all of a sudden they leave the room mentally. We might even make an argument that from a PTSD perspective, that a PTSD trigger response is a firefighter. It's the brain attempting to get us away from it. Firefighters are very powerful. They only come out when managers fail. So if a person constantly says like, oh, I have this like constant firefighter. No, you don't. That's a manager. Firefighters are the last line of defense. All right. So again, now the self is not included in this. These are roles for parts. These are not roles for the self. The self sits there and is conducting the orchestra and is the one that's going to help these take their roles. Okay. But exiles are super vulnerable. Managers protect them, keep them at bay, manage our day-to-day functioning. And when managers fail, firefighters come flying out to try to protect. There is a common misconception on for early therapists about exiles that the ultimate form of internal family systems therapy is getting people's exiles out. No. You want people to be self-directed. You want them to understand the exiles. You might be able to pull some exiles out and help them be less exiled, but the goal of IFS therapy is not to reroute the exiles and bring them out of exile. It's to see them as consultants, but be self-directed in the presence of those exiles. All right, firefighters only listen when they're called. It's only when you call 911. Firefighter ain't listening it. Managers are always listening. Exiles are always listening. Here's kind of the core path of helping a person work through internal family systems. Step one is you have to introduce language and the core concepts of IFS. There's no way in hell anybody in here would go through IFS successfully if you didn't know what the hell I was talking about. All right? Like, you have to have some core understanding of the fact that we are, and what we usually are going to talk about is the concept of self, parts, directedness, and definition of parts. All right? Like, those are kind of, that's what's going to be included within that. One of the other ways that we're going to be able to introduce that language is we're going to, as a therapist, I'm going to start asking about parts. Now, this is going to sound pretty much the same way that it would sound if I was asking people to give me an assessment of their actual like family system outside of it. You know, who gets along with who? Tell me about your brother. In the same way, I would be like, well, tell me about that part. Tell me about this. Tell me about, now, with no expectation that a person's going to say, well, that part's a manager and it shows up sometimes, and when it doesn't work, then this firefighter. I have no expectation of that. No IFS therapist ever will. The idea is that I want to get to know some of those parts and help a person develop some language that there are parts hovering around their self. So that's the first part. Now that should make sense because that's a big bulk of what we've done today. Step 2 to working through with IFS. After, and again, this is big here, okay? Doing this assessment of the parts and helping people name them is massive because you can't do step 2 without first doing that part of step 1. Is we are first going to work with managers. This is incredibly important. Even if you aren't a therapist and you're thinking about this and you're asking yourself, how can I apply this to my life? Get to know your managers first. Don't go for your exiles first. Get to know your managers first. I, as a therapist, have to build an alliance and trust. If managers don't trust you, ain't nobody going to trust you. Self-directed is going to be get out of here, all right? You have to, as a therapist, you really have to work with people's managers and help them understand their managers. You have to build it. You have to ask questions like, what do they want? What drives them? When do they show up? How? Lots and lots and lots of assessment questions. One of the things that as a therapist I am constantly doing as well is, and so if there's any therapists out there watching this who have to empathize with managers, you have to appreciate their roles. This happens internal too. I'm helping clients do this a lot if I'm working with IFS. You have to empathize with your managers. So again, when we talk about understanding and empathizing with the roles, it's right here. So we got to work with, how are your managers protecting your exiles? Why? What are they doing to regulate your behaviors? What do they want from you? What are they doing to maintain your functioning? How are they contributing to your internal dialogue? I want to empathize with that. I want to get to know it. I want to understand that better. Very, very important. This is a step that a lot of beginning therapists skip, and it drives me up a wall when they do. They go, I don't understand. Like, why won't this person cry in the room with me? And I have to say, because you are not empathizing with their managers. They go, oh, this person's so resistant. I'm trying to get into feelings, and I'm trying to get them to talk about the actual problem. They won't do it. I say, yeah, because you have to empathize with the managers. There's managers protecting. All this person does, or you'll hear it like, all my client does is just crack jokes all the time when I try to get serious. And you go, yeah, that's a manager. You're going to have to appreciate and understand why that manager's there. That manager's deflecting. That manager is trying to protect what's going on for that person. Again, when there are problems, it's because people are part-directed. If a person, theoretically, if a person came into therapy self-directed, they wouldn't have too many problems. It would be more to get an understanding of the roles of the system and how can I continue to regulate these parts better. For the most part, when people come to therapy, it's because there is some degree of part-directedness. So when, frequently when I'm streaming and you guys are asking me about how do I navigate anxiety? How do I handle negative self-esteem? How do I handle these things, right? The thing that I always say to you up front is you have to engage in self-validation and empathy for your emotional experience. You have to understand that. You also want to look at what you're doing as being functional in some way, and you're going to need to empathize with why you're doing that. If you engage in self-criticism when you're feeling a certain kind of way, you're polarizing in some ways against your managers, or you're overly listening to your managers. If you got a manager that shows up and says, you'll never be happy, like that manager is probably trying to protect you in some way by saying that, but we don't want to listen to that. That's not the kind of consultation we want to do with that part. It's not what we're into here. Managers are like the cat that kind of stands there with its hair on its neck, kind of looking at you like, They believe that they have your best interest in heart and that they will take care of you. And in some ways they have. They get reinforced. There are times when managers absolutely have something to say, but when they when they take the wheel and you're driving the bus and you're self-directed, and then they grab the wheel and say, no, go this way. That's where we run into massive problems. You don't want that. You need to empathize with, hey, man, I know you're scared. I know you want to turn right here, but I've got this. I want to hear what you have to say. I want to listen to what my emotional experience is here, but you're not driving the bus, man. I am. So then the next part, what we're going to do, if you have to, this is optional. I have to put the big old caveat here. If necessary, based on assessment. Students never listen to me when I say this, but I mean it. This is if necessary. Then, with permission from managers, cautiously and carefully work with exiles. Now, based on what we talked about earlier, this should make sense to you. At least I hope it does. All right. That we are going to want to have, in order for you to ever work with an exiled part, you are going to have to get permission from the managers who are guarding them to allow me in. All right. Because remember, if I'm going to work with an exile, it's probably going to feel very young. All right. And these guys are sitting here. These guys are like the Queen's Guard. The exiles are sitting in Buckingham Palace, or whatever it's called, and the managers are the Queen's Guard. And if you don't get their permission to go in, and you go barging through the doors trying to get exiles, the Queen's Guard are going to come in and they're going to take your ass out. Or they're going to call the UK equivalent of the SWAT team to come get you in the form of firefighters. All right? So you absolutely 100% have to build a relationship with people's managers and then get their permission to go for the exiles. This goes the same way for clients. We have to understand your protectors before we're ever going to jump in and say, let's go talk to your vulnerable parts. Let's go just dig into the trauma, friend. We have to understand the protective measures that are in place to avoid getting to that vulnerability, because if we don't and we're not careful, shit's going to hit the fan. You're going to possibly re-traumatize a person. That exile is going to further exile, because that exile is going to say, oh my God, apparently I wasn't exiled enough. If your ass could get in here and see me, I'm not exiled enough. So see you later, man. Like, I'm going to just, more managers. Need you. Come here, come here, come here, come here, come here. And then just, there's going to be 1,000 Queen's Guard outside of Buckingham Palace. So you don't want that. So we really have to get permission from those managers. If you were to ever hear me do IFS therapy, one of the things that I'm constantly saying to a person, speaking to their self, is I say, I'm wondering, or I might speak directly to the part, I'm wondering if you would be willing to hang out here for a minute. Would you be willing to, just for a couple minutes, would you be willing to hang out over here for a second so that I can talk to another part? I know you feel really protective of it. I really appreciate that. I know I'm scary. I know that you don't entirely trust me yet. I'm wondering if I could gain some trust from you, if you'd be willing to step aside. You don't have to leave. You can sit here. You can monitor me. You can watch me. But I'd really like to talk to this other part if you're willing to let me do that. And oftentimes when that happens, you can see a person kind of scramble through the consultation, and then they'll be like, okay. Or they might be like, no, I'm not ready right now. You go, okay, I respect that. I respect that. I'm not gonna go there. I'm not gonna do it. We'll go when you're ready. Apparently I need to build a little bit more trust with you. I totally understand that. And then I'm back to working with the manager. I'm not trying to barge the doors down going for the exile. So that's a big important piece. If a person says, yes, we can talk about it, then I'm watching. I am watching like a hawk when I am working with an exile. I'm watching for the other managers to come pop back, because they're looking at the first sign that you're going to squash that exile or make it hurt again, and they're going to step in. And the firefighters are sitting there at the ready. They got their gear on. They're sitting in the truck. They're waiting for the managerial call to 911. Right, so they're watching. So just a really important point that I always like to emphasize, and it's the same thing for you. Don't feel pressure to go to your exiles right away. You wanna get to understand your protectors. All right, so step 4 is going to be,
a new agent is joining your team.
after we have done this, again, number 3, if necessary, what we're going to do is we are going to repurpose You're going to repurpose parts in a self-directed way. What I mean by this is, so if you're wondering, like, I have this part and I hate it and I want it to go away, it's too bad. It's not going to go away. Parts just need to be repurposed. They just need to be recalibrated. All right, they need to take on different roles. They need to be consulted with differently. You do not ever get rid of parts. You just repurpose them. And the self is the one that does that. So you want to help parts find that compassionate purpose. That are, like, again, in the reflection of the self, right? Like, the self is kind, compassionate. And so we're going to want to repurpose those parts so that they are in the spirit of that. Is how this part is showing up? Is that in the spirit of compassion and self-directedness? If no, we're set some boundaries. If yes, welcome in, my friend. I'd love to consult with you. And throughout this entire process, what we're doing is, as a therapist, is I am constantly giving parts credit for giving me access to the self and to other parts. So the final part. So what does this look like when people are interacting? I would encourage all of you to check out the scene from Inside Out, where the mom's parts are interacting with the dad's parts. It is a truly brilliant piece of video. Like, it is absolutely excellent. What we see when we have problems in a relationship, I'm going to use a monogamous relationship just because it's easier right now for illustrative purposes. When people get into an argument, we would make the argument that they are not necessarily being self-directed. That rather, there are parts that are sitting here duking it out. All right, so instead of it being me versus you, we're basically like Pokemon trainers. And we've thrown our parts out into battle. And our Pokemon parts are going at it. I threw my Charizard, you threw your Alakazam, and now our parts are driving it. Okay, so it may be that a person's, we're all up in managers. Usually it's managers. More often than not, when I'm watching couples argue, I'm thinking, okay, we got managers out. And those managers are getting tied up together. And in a lot of cases, some people's managers play on other people's managers. Sometimes what you'll see is that one person's manager will actually really affect a person's exile and may actually pull a person's exile out. And then all of a sudden, you're going to get the swarm of managers. Because they're all like, hell no, get back. I know that this part has this tendency to, like, kind of, there's this manager here that's got this bow and arrow, and it's shooting these arrows right at you, and they're hitting, and you don't like that. And they'll come flying out. All right, so this is what it looks like from an IFS perspective when you've got two people in an argument. So our goal is to throw our metaphorical master ball and get them back in place, get them off, bring the barriers down, have people understand what parts are out, and help them be self-directed toward each other. We want to have people engage. And so this, again, this shows up as compassion, patience, validation, understanding, listening. If people are engaging in their relationships in that way, they're going to solve their problems best. So what we have to do is help people understand that. If you ever watch Dick Schwartz do therapy, which, I mean, why would you? You didn't go to school for it probably, but like, one of the things that I love, I remember my doctoral program watching a video of him doing therapy, and he was sitting with a couple, And it was a heterosexual couple, and I forget whether it was the woman or the man, got really activated and was like coming at the other person. And so Dick kind of stopped it, and he looked and he said, "Hey, I get a sense that there's a part out right now, and that part really wants to protect you. That part really wants to be heard. I'm wondering if you would be willing, just for a second. I'm wondering if you'd be willing to have that part step aside for a second, because I think that part, by taking over, I think that part wants something for you, but is not doing a very good job getting it. So I'm wondering if you could ask that part to step aside for a second. I know it might be hard for it to do, but I'd like you to just take a second in your mind, ask that part to look at the part, see it, acknowledge it, ask it to step aside, and then I want you to try again with the way in which you engage with your partner." It was amazing to watch the difference. Amazing. And when you have a person who's really adept at working through this stuff with a client or with a system, you can really change. Because again, change of the internal world equals change in the external world. All right. Could an exile be made by someone undermining you or another exile? So exiles are not so much made by other people. They're like the decision of what role a part takes is usually relative to what the input from the environment is. So exiles are not generally going to be made off of a one-off instance. They're usually happen with patterns, but it could be if somebody undermined, so I'll use that example, Cheesy Puff. Let's say that you have a part that really wants to trust people, like really believes that trust is the creme de la creme of human engagement. And so there's this person that means a lot to you. That part you place a lot of trust in that person. And so that part is really getting its needs met. It's like, oh my God, like, look at this. This is awesome. We've built this trust. This person cares. Look at all the things that I've done to build this trust. Like, that part starts to really get a lot of energy. And it's basically sitting there going like, thank you, self. This is awesome. And then that person, it turns out, has been completely screwing you over for almost the entire time you've known them. That they have been blackmailing you. They've been using all of that against you. They've been leveraging your relationship against you. All this stuff. Depending on how traumatic that is for a person, there's a chance that part may then choose to take the role of exile and say, I'm out. I wanted to trust, and now all of a sudden I'm having to carry the pain and trauma of what just happened. I'm ashamed. I was so vulnerable and I got screwed. I'm out, man. No way. So then what happens is now all of a sudden you have this new relationship, and that relationship, as all healthy relationships do, calls for a bit of trust. Well, if you've exiled that part that pushes for trust in relationships, and that part's been too hurt, there's a good chance that managers are going to step in. And let's say you have a manager that steps in and as a means to protect that trustworthy part is a complete asshole to anybody who they want to build trust with. Is like basically like continues to try to put distance as a way to control that. It's this part that wants control in the environment, steps in as a manager to protect that exile that tried to trust. And so now interactions that are calling for trust, that if self-directed would include behaviors that facilitate trust, now all of a sudden a manager's running the show. Manager's sitting here going like, don't you dare trust that person. Keep a distance. Watch, be vigilant, ask annoying questions, show that you're smarter than them, whatever it might be. And that then becomes a managerial directed thing where now all of a sudden the manager's not being consulted, the exile's not being consulted, the manager's driving the bus, as opposed to the self saying, hey, exiled part over here that's afraid of trusting people, I see you. Not gonna come too close to you. Just want to let you know I'm here. And hey, manager that's trying to protect it, I understand what you're doing, but this is a new relationship, and I want to trust people. What were the things that I was doing? I'm going to do it, and I recognize it's going to be scary for me to do. I recognize you're not going to like it, but this is what I want to do. So thank you for consulting with me. That's kind of how this works. Again, anytime a person has an issue in a relationship or in their life, one of the things that we're going to be thinking about from an IFS perspective is that you must be part directed right now. That there's parts that have either taken too much or are doing too much. They're being the most. We don't want that. And so what we want to do is help you move to a space where you're self-directed. The way that we do that is by helping you understand what those parts are by doing a bit of an assessment around it, by getting to know the managers that are protecting those exiles and protecting that self and are kind of managing the day-to-day, getting permission to go for those exiles if it seems that it would be meaningful to do that, and then helping repurpose those parts in a self-directed way so that as you go through solving this problem and you go through life, you are self-directed in the way that you're doing this. You're constantly asking and evaluating your parts, really trying to make sure that the symphony is in harmony as often as it can be, so that you are leading as much of a self-directed life as possible. And we do that through, mindfulness and naming those parts and those types of things. But that mindfulness is embedded within this entire thing because, Dick Schwartz talks all the time about needing to do some level of mindfulness of like sitting and listening to yourself and looking at the parts that are hovering around it. And I would encourage you, if you want more information, you want to hear it directly from his mouth, on YouTube, there are videos of Dick Schwartz talking about internal family systems that are really great, and I would recommend you check them out if you like them. I hope that you have found this to be helpful in some way, and that if you're a therapist watching this, you might think to yourself like, hey, that's kind of cool. That's really helpful for me to know how to conceptualize this more effectively. And if you're a person who's just not a therapist but living your life, you might be sitting here going like, whoa, this is really some cool stuff to ponder and think about. If this really, if you're jazzed up by this while I'm talking about it, you're sitting here going like, damn, I would love this. Seek out a therapist who does internal family systems work.